I've been a doctor since 2002 and it's definitely been the most emotionally challenging period through which I've worked.
It somehow became normal for us, wearing of PPEs for more than, I'd say, 10 hours, holding our bladder, and sometimes skipping our meals has eventually become a part of our work routine.
I actually moved out at home when I was working during the first wave of COVID. I was quite nervous of bringing it home because my dad had a medical condition, so I was afraid that I'd infect him, so it's heartbreaking. It was my first time out of home, so.
Worked throughout the initial lockdown period, and then I suppose I had 4, 5, 6 months where I didn't get to see any of my family.
Pandemic has made frontline workers, I think, more aware of their mental health, and I think has probably emphasised the importance of looking after the mental health of people who are caring for very sick and acutely unwell people.
The level of support that Heroes Aid are providing has changed over the last year. So originally it was set up as a practical providing PPE for frontline healthcare workers, and now it's moved on from the physical providing masks and gowns, etc., to now focusing on well-being of the frontline healthcare workers. So it's also moved into psychological PPE.
Psychological supports are needed. Many don't want to go to their employer for those supports. Many want to go to somewhere independently for those supports, somewhere they know is going to be confidential and trusted. And Heroes Aid has teamed up to do that and to provide those services free of charge for people in those circumstances.
So with Heroes Aid, we can definitely give them a ring. They would always give us free counselling.
The online support I found really helpful because it's quite easy to use from kind of the comfort of your own home.
That 24-hour service is really helpful for healthcare workers. A lot of us will work, 12-hour shifts or unsociable hours as such.
We're just a phone call away.